energy shot that causes
39 on one side, 37 on
360
one side.
degrees of injury.
वो camera इधर दिखाओ.
Look at this artery. This
On
artery's
this.
been ablated, but the entire endothelium,
I just want to see
media
this,
has been
both
spared,
together.
and you get this circumferential
On
lesion
this.
set. This is one nerve from that circumferential lesion set that is evidence of inflammation and fibrosis. We did our first in-man study in the Czech Republic, and basically in 10 patients, small,
You can
we
tell that.
see at 3 months and 6 months reductions in systolic and diastolic
Yeah.
blood pressures
Dikhao.
similar to the Simplicity data set. So I really think that this approach where you're targeting what you really want to target, adventitial nerves and not the artery,
Pura
is the
dikhao.
future for renal denervation. But we need
ठीक है.
evidence to support that claim. Now, Kona Medical
और
is
घुमा
another very exciting company. What they propose is to use focused ultrasound, but this is completely non-invasive. Imagine going into a clinic and having a transducer stuck to the back of your flank. You turn on a button, focus energy focuses around the renal artery, denervates you, and you're all done.
और last
Clinical
वाला
studies ongoing.
इनको बोल देना last वाला.
St.
दिखा
Jude
देंगे बाद में.
Enlighten catheter.
End result.
You see 4 different catheters in
After
different
these two,
positions.
end result
You
coming.
place it in the renal artery, 90-second ablations at each electrode. Arsenal, first study that
How's
shows
Rajneesh doing,
significant
sir?
reductions at 30 days. The Vesix balloon is sort of geared toward the interventional crowd, which is what all of you are. And basically what this is RF electrodes mounted on the balloon using bipolar rounds. And you just have to turn RF on for 30 seconds. So after 1.5 treatments, which is 45
ये
seconds,
दिखाइए दोनों.
you're done with ablation on both
नहीं, ये
sides
दोनों
in
देखो.
under 2 minutes. Pretty remarkable. Again, this is all
हम दोनों एक साथ
preliminary,
दिखाना
very
है.
early
दिखाना है
data.
दोनों.
10 patients, you're seeing
ठीक
a
है.
30 or 11 millimeter
नहीं नहीं
reduction
दोनों
in
इकट्ठे
mercury.
दिखाइए एक साथ.
The Covidian
दिखाना
one-shot
है.
balloon approach, again, similar concept to the previous balloon. You see a helical RF electrodes wrapped around the balloon. The advantage with this balloon is that there is some irrigation. So
इसको
there is
दबा
this
लो.
concept, even with the RF community, that irrigation may help protect
इसका
the
मतलब
artery,
खाली
both from
सब pyramid of
preventing
packing
char
करते हैं.
formation and maybe
Possible.
some
Just
amount
process.
of
No,
intimal
just
sparing.
put your hand.
No,
here.
no. You can put
Okay,
one.
put your gloves
I'm
on.
going to
No, no,
conclude
take
by
this
basically
gauze.
talking to you about the
Yeah, glove
future
pad.
of renal denervation. I think probably the most important thing here is for us to wait for the Simplicity
ये
3
सब क्या
data
करते हैं
set.
ज़्यादातर
We really need to be
they get this
convinced
made from,
scientifically that this is
Denmark,
not
Denmark से
a
लेके
placebo response.
लगा के.
करके
And the
दे
Simplicity 3
Yeah.
trial is a very
Just press this.
well-designed
It's a vein
study
vein.
where you have about 500 patients getting enrolled, and you get randomized to the sham procedure only after performing the renal
After this,
angiography.
show the
So I
last
think
one.
this
After
data
I
set
did
will
discuss
sort of clinch in all of our minds how effective this procedure is. Down the road, we will need larger studies looking at really strong endpoints such as mortality
इलेक्ट्रॉनिक
and
वाले बहुत
stroke.
गाली देंगे आज. उनको बताएंगे ना.
Probably the most important
but they
thing
should
when
know
you
what-
offer somebody a therapy where you
Exactly.
go in and
I
make
think this was
burns in the
sponsored
renal
by-
artery right next to your only kidneys is safety.
This
And
guy,
although
Abbott.
right now most of the
Boston
data set, now this
Scientific.
catheter is approved and people are doing,
Yeah.
multiple procedures have been
So,
performed in Europe. We will
उनका
need
बेचारों का
longer
था ही नहीं.
follow-up because the magic question is, okay, it
Peripheral
looks
में
good
है
at
उनका.
1 year, it
हाँ,
looks good
उनका
at
एपिक
2,
को
it
नहीं
looks
था,
good
but
at
they didn't have
3.
the size.
What about 15 years from now?
Huh?
What about arteries that have some
Can
atheroma that
you
you
hold
can't
for 5
see
minutes
and you
because
burn
they're
over
doing
that?
the live thing.
And that's where the
If you can hold
Simplicity
it fine, otherwise
registry
it's also
kicks
it's fine.
in. They aim to collect data from about 5,000 patients, and this will really give us a glimpse into how safe this procedure is in the
इसका कैसा चल रहा
future.
है सर रजनीश?
But talking about
सरदाना?
safety, even at 3
है
years
ना?
with
वो
angiographic
मस्त-
follow-up
मस्त क्या है
and
साला?
non-invasive studies,
काम ही नहीं
we are
कर पा
really
रहा है.
not seeing any evidence of
Jungle में
trouble
पूरा
brewing down the road. You have a scattering of
यही हाल है
case
मेरे ख्याल
reports
दिल्ली
of
में.
stenosis
यहाँ पे
and
इधर से बाहर
thrombus,
निकले तो यही
but
हाल है.
overall, if you follow the
हाँ, तो सब
recommendations
डिवाइड में
with the
बेचारा खाली
Simplicity
आ रहा है.
data, it looks to be fairly safe and effective.
बिकॉज़ आर अभी मेडिकल मैनेजमेंट रोक लेते हैं लोग.
हाँ, 90%.
और
Then comes the magic question of mild to moderate hypertension. Now, in my mind,
संगीन
until
होता
we are
दिल्ली में.
convinced that this is safe and effective for resistant hypertension, we should not even go there.
हाँ,
But
let him
people
pass.
can't wait. There's
No
already a
problem. Let him pass you.
preliminary pilot study out there
So-
showing effectiveness in this population. So you can just about imagine
structured
the
जगह है ना,
implications
Scott
of a
से
therapy like
बनता है.
this
वहाँ कोई
in
problem
general, 1.6 billion individuals by 2025,
सब आदमी नहीं
and you
लगा
have this
सकते
one
device।
procedure that seems to offer not just hypertension control, but other, other benefits.
We can get the boy for the.
Then comes the magic question about, does everybody respond? Now, most of the data seems to indicate about a 80 to 90%
This was
responder
pretty
rate.
hard lesion.
And
I
we
thought
don't
it
know
was very
why
soft.
some people don't
Initially,
Whisper
the way
would
it went,
pass.
मेरे को
Is
लगा
it because
No,
we didn't
I thought the
ablate
whisper
enough,
would pass,
or
it
do
never
they
passed
not
through.
have
And the way it
excessive
dissected, it
sympathetic
was very
activity?
hard fibrotic
And
lesion.
there's a lot of discussion about
nice,
when
very
we
nice.
see a patient with resistant hypertension in our
Normally,
clinic
whisper
and
would
we're
pass in
talking to them
90%,
about renal
95% of
denervation,
cases.
can we identify patients
Yeah, yeah.
who
that's
do
fine.
not have a prominent
Huh?
Yeah, yeah.
sympathetic signature?
Yeah, yeah.
So we
Sure,
know
sure.
upfront that this is not a good patient for denervation. It's unanswered as yet. And then comes, after you turn on RF and you make
That
3
अभी jet lag
burns,
चल रहा है
4
इतना
burns,
हाँ,
5
वैसे
burns,
अब-
6
I mean, I
burns,
went
when
for
do you
just-
know it's enough to stop?
Just 36 hours.
Now, 4 to
For
6
what
burns
meeting, sir?
came
I had 3
from
presentations
animal
there.
data. Do these
Almost same dates में होना था।
non-responders,
Icon
did
is
they
a very
not
big
get
meeting
burned
for,
enough?
endovascular.
Was each lesion good?
And then
There's some
because we do
preliminary
this
data
conference
that
in
if you
association
use
with
an
IACS, which is
electrophysiology catheter
International
that we
Society of
use,
Endovascular Specialists,
place it
CP
in the
meeting.
renal artery,
And
use
then
high
I just took a
frequency
flight back.
stimulation from within the
बाद में
artery,
2 बजे पहुंचा रात में।
stimulate the
सुबह
nerve,
अगले हफ्ते जाना
you
है
can
ACC
see
में,
an
मैं भी ऐसे ही
increase
जाऊंगा।
in blood
9 को
pressure.
पहुंचूंगा, 11 को निकल
You
रहा हूँ
finish your ablations,
The only
stimulate
advantage is that
again, and
probably
you
jet
don't
lag
see an
कम होता
increase
है।
in blood pressure.
आने जाने जल्दी
And this has been
Because you are
suggested to
never
be a marker
adjusted to
for
that time.
That's right.
acute
But doing a
denervation
case
in
is
the
something.
lab, which I think, if stands true
नहीं,
and
वही
is
मैं कह रहा हूँ, मुझे jet
tested,
lag
would
कम
be
है
very
as compared
useful
to other
tool
US
to
visits.
know when you're
Because
done
I
in the
could
lab.
hardly get any time to
Time
get to US times.
readjust.
And finally,
So
what
ज़्यादातर तो आप
is,
flight में ही
is
रहे ना।
this therapy
हो सकता है
going to
Indian
be
time ही चलता
restricted to
रहा।
resistant hypertension? Will it be offered to people with mild or moderate hypertension? And importantly,
असल में हम लोग ज़्यादा कर नहीं सकते।
how
दुकान बंद
far
करके
will
जाना
we
होता है।
take
तो
this
बोला,
therapy? Are we going to
कहीं भी
offer it to
something
patients
is
for
here.
all the other
Maybe
benefits
here
that we talked
or
about?
anywhere, you are
And
in
as
the
an
job, तो ठीक है,
EP,
छुट्टी है तो छुट्टी है।
the
Feel
data
without
that was published in
लेकिन
JACC
ये लोग
regarding
फिर
atrial
सोचते हैं
fibrillation
productivity क्या
is
it comes
very
back in
thought-provoking.
other
We've been
way.
trying
Comes
to
back to that.
modulate the
Monkey
sympathetic nervous
technique.
system for many years for VT and AF. We've done cardiac, cervical sympathectomy, high-frequency stim and ganglia modification in the heart. This may ultimately be the one most effective sympathetic modifier that helps control arrhythmia. As for the work that we're doing at Mount Sinai, we use the Celsius thermocouple catheter, and I'm sort of going to make a plug here for what we do.
Live ना हो जाए, मैं बाद में बात
The Ardian catheter is not approved in the U.S., and it's an expensive catheter. I was reading, it costs around 3,500 to 4,000 euros. The Celsius thermocouple catheter, on the other hand, is something that every EP has in its lab. The Stockard radiofrequency generator is what everybody uses. The cool flow pump is what everybody uses. And right now, we've done over 150 patients. We haven't published our long-term efficacy and safety data yet, but there seems to be just as efficacious and safe. And I think using irrigated radiofrequency, at least in the short term, is a way to offer this new treatment to patients. I don't think we'll be using the Celsius catheter 5 years from now, because there'll be better
You're going to the-
catheters, but for now I think it's a reasonable
To the
catheter
venue, sir,
to
after
use.
this?
Thank
Okay,
you.
Back to the hotel now. Talk है आपका भी.
Talk नहीं है. Okay, let's go.
You. We'll request you to hold on because we are getting
Join us
2
with the-
minutes.
on the
yeah.
chair.
Why don't you come over here, Dr. Gure?
Oh.
We've got 2 minutes to go back to the labs because the audience must be also curious to see the results. So can you go back to one of the labs first and then the other one for 2 minutes each? Okay. Dr. Khanna, we are with you in your lab.
Okay.
Can you show us your final results?
Yes, I can show you, but I want to show you if you can see the screen. On the left side, we have a.
We are seeing the screen in
Okay.
just 2 minutes.
Okay, just 1 minute. So on the left side, we have a stent which is 7 into 37 millimeter. And on the right side, we had that previous stent where we left, it is 7 into 39 millimeter. I can't understand how there is so much of a difference. If you see that stent, 2 millimeter extra long stent hangs about 7 millimeter, and here it perfectly fits in, rather falls short by 2 millimeter. Anyway, this is the stent from the same company, Medtronic Invatec, but I think there is a problem in the length of the stent because they are right in front of you. What we finally deployed was a 7 into 37 millimeter on the left side. And can I go to the final result? And this is the final result which we got. This is a 7 into 37 millimeter stand, which is very well accurately placed at both at the ostium and sort of sparing the vertebral.
That's an excellent result. There's a little plaque at the vertebral, which is probably
Yeah,
not very significant.
That we didn't want to touch
Dr.
anyway.
Khanna
Congratulations.
and Dr. Jaishankar.
And now we'll go to the other lab to see. George, we are here with you for 2 minutes to see where you've reached.
Just don't remove the TR band, and slowly you know how to deflate it. And this sheath, we should take it out and maybe put an 8 French sheath here and then stitch it.